Hi, my name is Derek Spratt. I'm 50 years old and I live in Vancouver, Canada. I recently underwent spinal fusion surgery at L4-L5 and L5-S1 in my lower back. I'm going to discuss with you the conditions pre-operatively that led me to have the surgery. In my late 20s, I started to have what is referred to as discogenic pain. This is not sciatic pain where there's pain that is referred or radiated down your limbs or your legs. This is pain that radiated just generally from my lower back. It started out with me being uncomfortable sitting in a chair for long periods of time, and I noticed that it would be aggravated if I did heavy lifting or bend, lift, twist maneuvers. Several hours after that, I would find that my back would be quite sore. I started going for physiotherapy in my late 20s, early 30s, as well as some chiropractic treatments. I had several chiropractors that used what's referred to as high velocity maneuvers to realign my spine, and later on I started to suspect that these high velocity maneuvers were in fact providing stress on my discs and micro tearing, and in some cases perhaps even more significant tearing of the discs. I developed a condition in my mid-30s where my spine, my lower spine and my lumbar region were getting quite loose. The discs and the connective tissue was getting quite loose, and my hips would start, my pelvis would start popping out, and I would start walking around quite crooked, and then I would be in quite a bit of pain and get a lot of inflammation. And unfortunately the chiropractor would sort of jump on my hip to pop it back into place. Later on I stopped going to chiropractors and I started just dealing with what was a very intelligent, educated physiotherapist who said, listen, no high velocity maneuvers for you, buddy. Your discs are starting to fall apart. We didn't have MRIs. We had some basic x-rays to work with, which didn't really show much. But I eventually, by my mid-40s, had so many episodes where my pelvis had popped out and I had loss of leg function that I finally decided to get an MRI done in 2005. And that actually showed that my facet joints at the two lowest segments, my L4-L5 and L5-S1, had started to really pack it in, and that the discs themselves had herniated and showed scar tissue and had also shown signs of deflating and effectively moving closer and closer to bone on bone. One of the risks that you have when your discs start packing it in and having these continued tearing and this destabilization is that you risk nerve damage and scarring that can affect everything from bladder and bowel function to just leg strength and core body strength. I was suffering from the nerves in my torso, specifically in my lower back, really not settling down. They were always sort of slightly inflamed and angry, and the discogenic pain, that generalized pain in my waist, my pelvis area, would radiate out and would cause me to feel very weak and tired, hard to stand for long periods of time or walk for long periods of time. Ultimately, more MRIs, CT scans, bone density scans showed that my body had in fact experienced significant degradation at my L4, L5 and L5-S1, and that it would be likely that fusion would be the only option for me. The fact that I had both the facet joints as well as the associated lumbar discs degrade simultaneously together was a good indication that that was my only possible outcome. So I had an excellent surgeon that I referred with, very cautious fellow, Dr. Marcel Dvorak, who heads up orthopedic surgery at Vancouver General Hospital here in Vancouver, Canada. Marcel took the appropriate precautions. He worked with his team of half a dozen orthopedic surgeons to get sort of an internal internal second opinion, and we really determined that although we didn't have sciatica and we didn't have specific individual nerve root impingements, we had a generalized discogenic problem that indeed would respond well to fusion surgery. The surgery we chose, the minimally invasive surgery, involved fairly small incisions on either side of my lumbar spine, and you can hear all about me explain the details of my spine and see the MRIs and see the results of the instrumentation and the discs in my 2-week post-operative video. I recommend that anybody that's considering spinal fusion surgery approach it cautiously. get a very knowledgeable physiotherapist and a very cautious surgeon, and work through core strengthening, work through all of the alternatives to surgery, exhaust those alternatives, and then if you need surgery, don't be afraid to have the surgery. There's lots of stuff on the internet about people having difficulties and experiences. Often it's because people have compound problems, and in my case it was I was healthy and obviously knowledgeable, had done all the right prep, I was in good physical shape, went into the surgery. I'm currently 4 weeks post-operative, and you know, the area in my lower back is still sensitive. I still get tired, but I've been driving a car, and I've been back at work since you know, basically a week and a bit after the surgery. So successful outcome so far, and I will give a 6-month post-operative update, or maybe a 3 months post-operative update as well. Thank you.